Now with a report on community service, here's our reporter, Laura Windsor.
During their education at Southwest College of Naturopathic Medicine, students receive their clinical training at the college's medical clinic, but their training also includes multiple community clinics.
Mission of Mercy is a mostly volunteer organization. There's 3 sites throughout the country. One is in Maryland, one is in Texas, and one is here in Arizona. It's a free clinic where we serve the uninsured and the underinsured. So we don't charge for our services and we don't charge for the medications and treatments that are dispensed. There are all kinds of doctors there, actually. So our medical director, Dr. Brad Smith, is a naturopathic physician, and there's a ton of other volunteer physicians that come to the different sites. So we work with family medicine practitioners, internists, cardiologists, ER docs, dermatology. Pretty much any specialty is welcome to come and volunteer some time there. So what I do while I'm there is I supervise our naturopathic medical students while they engage in patient care. So they see patients from start to finish. They do intakes, they do physical exams, they create treatment plans. We're serving a population that otherwise does not have access to health care. So the way it works is that we're a traveling clinic, and on different days of the week we're at different locations. We do chronic care, so we see a ton of diabetes, hypertension, thyroid disorders. We also do acute care, so we see a lot of respiratory infections or dermatology complaints and everything in between. It's a great place for our students to see a variety of patients. So on average, about 70 patients a day go through our clinic, which is a huge number and a great experience for our students. So they really get to practice the full extent of their primary care training. They get to do diagnosis, they get to see patients, they get to do treatments, they get to work with all sorts of allopathic practitioners as well, and they really get to see integrative medicine. So a lot of our treatments tend to be more pharmaceutically oriented or traditional, but wherever possible they get to integrate a lot of easy things and inexpensive things that this patient population can do on their own.
The students at Southwest College get such a unique experience at Hamilton because they're dealing with a population that is most in need of what we do. When the very poor go to community clinics, they're often very busy, they're often rushed in and out of the clinic, and not very much holistic care is provided to them. And what we do at the Hamilton Clinic is really unique in that we sit down and we really try and get to know the family and try and understand what the environmental stressors are on that family and therefore the child, and that helps us provide really excellent holistic care to them. It gives them the chance to put into practice exactly what they learn in the classroom. The parents and the children are extremely pleased with what we do. They don't get this kind of care anywhere else, in that we take into account the child's entire surroundings, their life, their school life, their home life, the food that they eat, the water that they drink. I mean, these are all important points when we're trying to pick up some real key factors in a child's health and how they're growing and developing. A few years ago, a 13-year-old came into our clinic with chronic migraines. He had had migraines for the past 2 or 3 years, and every time he had gone to the doctor's office, he had gotten drug after drug, which seemed to abate some of the symptoms for a little while, but it never really took care of him entirely, and his migraines never went away. They just kept on coming back, and he needed larger doses of medication. After an assessment of his diet and some vitamin and mineral therapy, we were able to get rid of his migraines for good, and he didn't need to go on any more medication. His parents were so pleased, he was so pleased, he was doing better in school because of that, and that really made me feel like I was making a major change, and that's why I do this medicine.
Not only do these medical students receive important training, they provide an invaluable service to their local community. For Discoveries in Alternative Medicine, I'm Laura Windsor.